Again, I'm joined here by Dr. Alexander Scott, Tom McCarthy, Executive Director of the state's COVID Response, Education Commissioner Infante-Green, and Commerce Secretary Pryor to share some of the updates week over week. Also, again, our nominee for Sabina Matos is here as well, which she'll be continuing to be updated. Hopefully today she's got a first hearing with the Senate committee, and next week we expect that to be confirmed. And then next week, when we're sitting here on Thursday, Sabina will be our Lieutenant Governor. We're making great progress. I think that you've seen a number of the reports. New York Times ranks Rhode Island 9th on first doses administered, second individuals fully vaccinated, second and third in doses used. We've opened 3 new vaccination sites this week: East Providence, Johnston, and Woonsocket. I visited yesterday in East Providence, a regional site, municipal leaders with Bristol, Warren, Tiverton, and Pawtucket joining East Providence. Right now, 97% of Rhode Islanders have access to vaccinations within a 15-minute drive. And over the last week, I visited vaccination sites in Middletown, Westerly, and East Providence, as I can mention. We continue to see continued positive response from our residents in the state. And we want to thank all the municipal leaders in particular for their staff and volunteers who are working side by side in this effort to get people vaccinated in the state of Rhode Island, along with our EMA, REMA, our Emergency Management, our National Guard, with the leadership with Tom, General Callahan, and Tony Silva, in conjunction with working with Dr. Alexander Scott to make sure that we're doing it safely. So we continue to accelerate the eligibility timeline. This week we opened to 50 and older. Next, on April 12th, is 40 and over, as we said last week. And then quickly we'll be converting to 16 and over on April 19th. By May 15th, we expect 70% of Rhode Islanders age 16 and over will have at least a partial vaccine protection, where June 17th, we expect 70% of Rhode Islanders age 16 and over to be fully vaccinated. To reach these benchmarks, we need everybody working and agreeing to get vaccinated, so we're going to continue to make sure that we make that an emphasis in all our work. The first round of notifications went out to Rhode Island's vaccine interest notification list this week, and I want to encourage Rhode Islanders to continue to get on the list so you can be notified when a vaccine becomes available, and you can sign up at portal.ri.gov. Right now, Rhode Island is ranked among the top in the nation for vaccinating seniors. That ranking is something to be proud of, and I thank everyone who has helped get us there. We're also getting more of our vulnerable communities and members of the BIPOC community vaccinated, which is our Black, Indigenous, and people of color. Over the last couple of weeks, there's been a big effort to increase outreach accessibility with these populations. So any community that we're not meeting or exceeding the percentage of population against the vaccinations, we're going to make sure that we put a big effort in there. And we are doing that right now in this community, because there is a spread. Right now we have less vaccines going to the arm than the percentages that those populations actually represent. We will be working in the same measure with the men and women right now. 60% of women are getting vaccinated, 40% of men. We can't have that continue and get everybody vaccinated in the state of Rhode Island. So we'll be working on that as well. So we're going to continue to work, additional news on the high-density community strategy, which targets hard-hit communities. Eligibility will be open to Rhode Islanders age 16 and over in certain zip codes over the next several days. A Tier 2 high-density community eligibility will open up on Friday, April 9th, for all of Woonsocket. And Tier 2 high-density communities eligibility will open up on Monday, April 12th, for certain zip codes in Pawtucket, West Warwick, Providence, Cranston, North Providence, East Providence, and Johnston. So you can visit covid.ri.gov/vaccination for more information on eligible zip codes within these communities. And we're also glad to share today that proms and graduations will happen this year. In just a moment, Dr. Alexander Scott will walk us through what that looks like, but that is good news, and I know that the schools and all the students in the schools are looking forward to that. So there's a lot to look forward to, but there's still a lot of work to do, a great deal of work to do. Next, we'll take a quick look at our vaccine numbers for the last week. Almost 268,000 Rhode Islanders have been fully vaccinated. We've administered more than 500,000 doses in the last 3 months, and we have the capacity to vaccinate even more. Again, our capacity is to do 160,000 shots in any given week, and I believe that we'll even expand on that over the coming weeks as more supply comes in. Point of information, tomorrow at 5 p.m., just over 20,000 vaccination appointments will go live. You can register for an appointment online, vaccinateri.org. There'll be 20,000 vaccination appointments that will go live tomorrow at 5 o'clock. Finally, we know that all Rhode Island is still in a race against the variant, and we still have to be careful about our case counts, our hospitalizations, and proceed with caution. But there is a lot of motivation right now, so we can enjoy a lot of momentum. We're very motivated to get people vaccinated, and we're going to enjoy a real 4th of July. So we expect that there'll be parades and fireworks on the 4th right here in Rhode Island. And I'll end with this message to Rhode Islanders. The fastest way through this pandemic is getting shots in the arms. And so don't miss your shot. I carry with pride this card, which says that I have been fully vaccinated. We want every person in Rhode Island to be able to carry this card that they have been fully vaccinated. So that's a really important thing that we want to make sure there's our objectives. We will vaccinate the ocean state and get back to the kind of Rhode Island summers that we all enjoy. Before I wrap up, I just want to acknowledge that in addition to COVID-19, which is our top priority, there are many other critical issues that are facing the state of Rhode Island. So our team will be setting up a regular press conference to discuss non-COVID topics and take questions, starting not next week, but the week after Sabina is sworn in. Both the Lieutenant Governor and I will be there, and we'll have more details to share soon as we plan to start this in the next week. Not next week, the following week we'll have that open press event, and we'll be talking about those issues that we know are really important. Today we'll talk about COVID, but we want to make sure that there's information that's flowing throughout the state of Rhode Island, these critical issues that we're dealing with day to day. With that, I'll ask Dr. Alexander Scott to come up and provide us some more information. Thank you, Doctor.
Thank you, Governor. Good afternoon, everyone. Thank you all, as always, for being with us today. As you can see on the screen, we have 360 new cases to report today. That's out of 17,219 tests, which is a percent positive of 2.1%. Our weekly percent positive for last week held steady at 2.4%, which is slightly elevated above the 2% range where we had been hovering for several weeks. We are still seeing a lot of cases in Rhode Island, often over 300 or 400 new cases each day. This is partially attributable to the fact that we are doing so much testing. We're continuing to lead the nation in testing, but it also means that we're still seeing a lot of disease in Rhode Island. We are seeing cases throughout the state as well. This is not localized to just one area. 19 out of 39 cities and towns had a significant increase in cases over the last 5 weeks. And in some places, such as Bristol, Middletown, and West Warwick, those increases have been even more pronounced over that amount of time. We're also seeing the demographics of our cases shift to being slightly younger. In terms of hospitalizations, we have 154 people currently hospitalized with COVID-19. As we saw with our cases, we have had a slight increase in hospitalizations generally as well. We know hospitalizations lag behind and are starting to follow the same trend. We're also seeing the slight increases occur specifically amongst people in their 20s and 30s. As I've said during previous weeks, when you think about these data and the trends that we're seeing and wanting to make sure that we bring to your attention, we look across the current COVID-19 landscape to really understand what's going on. We're holding steady, but that's based on two elements that are contributing. We know, as the governor reminded, that there are more contagious variants of COVID-19 continuing to circulate in Rhode Island, and they spread more aggressively than the previous form of coronavirus. Knowing that that's happening, it's actually balancing against the fact that we are doing as strong a job as we are with vaccinations. We have vaccines that are extremely effective against coronavirus that causes COVID-19. And we have done a very good job of getting those people most at risk vaccinated, such as our older adults or those in communities hardest hit that we're focusing on. However, many of our younger adults have not been vaccinated yet, and children are not yet eligible to be vaccinated. And so we need to make sure that those who are eligible to get vaccinated, every single individual, whether they're watching this or not, that they all have access to getting vaccine administered to them. Our takeaway, and we want yours to be, is that the vaccine works. It's really helping us to hold steady during this time as the variant is spreading, instead of increasing in cases to the extent that we are seeing in other states. Everyone should get vaccinated as soon as you are eligible. We're doing everything we can to make vaccine as accessible as possible in Rhode Island, especially in the communities that have been harder hit, such as our higher density communities and our communities of color. We've been working closely with the Governor's Equity Council to make sure that we have slots at the Dunk and our Woonsocket vaccination site this weekend and next weekend for people from harder hit communities. And this is in addition to the age eligibility expansion in several additional zip codes that the governor mentioned and that Tom will go into more detail on shortly. We want to get at this from every angle possible, and we need you to help do your part. People are encouraged to vaccinate and follow that advice when it comes from people that they know, people that they work with, people that they love or are cared for by. As hard as we are working to get people vaccinating and as much progress as we are making, again, we know that the vaccine is just one tool in our toolbox that will get us over the hump. Testing, treatment, and vaccinations. We know that those are the critical elements, and we want to make sure that across the board, everyone is wearing their upgraded mask as effectively as possible as well. It is critical that we continue to wear our masks whenever we are in public, even if you have been vaccinated. And testing is so important because it helps us get ahead of the clusters of cases. We can only identify those clusters and do something about it, get people treated, help them isolate if we know that they're there. And that's why it's important for us to continue to lead the nation in testing. The new guidance that we're announcing for venues of assembly today is anchored on these core principles that we're talking about. We know testing is important, it sets people up for getting treatment. We know vaccinations are important, and we know mask wearing works. The two key dates that we're watching right now are May 15th and June 5th. As the governor shared, it's important for all of us to center around this. By May 15th, we expect that 70% of Rhode Islanders 16 and older will have had at least one dose of vaccine and have had 2 weeks pass since that point so that they can experience the partial vaccination coverage that's important. Getting 70% of our population to that mark of being 2 weeks after their first dose is a milestone for us, and that's that May 15th target. Being able to reach that allows us to have the confidence as we continue to make the changes and expansion in reopening our economy. And by June 5th, we expect that 70% of all Rhode Islanders who could get a dose, out of all Rhode Islanders, children, adults, and all, that it will be 2 weeks after all of those individuals have had at least one dose. The 70% mark and having that partial vaccination 2 weeks out from last receiving that first dose is the same critical marker that the governor has mentioned previously, and it is what we can really center on together. Let's work with everyone around you to get us to that May 15th point so that anyone who is eligible, 16 and older, is able to have at least one vaccine administered to them and receive the protection from that 2 weeks from there. That's our May 15th date. And by June 5th, it's out of all Rhode Islanders. It's 70% of all Rhode Islanders that we're aiming for. With those dates in mind and everyone centered on getting as many people around you that you know to get vaccinated, that's the confidence we can have to move forward in reopening our economy incrementally, safely, and effectively. For events that food will not be served at, such as commencement ceremonies or concerts without food, we're using 3 phases. Between now and May 15th, these events can happen with 250 people indoors or 500 people outdoors. Once we get to that May 15th mark with everyone reaching 70% of those who are eligible to get vaccinated, having at least one dose, our events will then be able to shift to 500 people indoors or 1,000 people outdoors in a way that you can all join in that experience, knowing that the majority of our population has had at least one dose. And then from that May 15th to June 5th timeframe, after June 5th, the events would be able to expand even further to 500 people indoors or 2,000 people outdoors, with the confidence of knowing that 70% of our entire population will have had at least one dose 2 weeks out from that, experiencing the protection. These are markers that we're setting that we can all reach together. You can all do your part. If you haven't been vaccinated and you are eligible, go ahead and get vaccinated. Tell your family members, tell your coworkers, tell your loved ones. The more we can as a state reach those markers on May 15th and then June 5th, the more confidently we can engage in all of the activities that we want to aim for. At all these events, masks are required and social distancing is required. And for any indoor events, testing is strongly recommended 48 hours in advance for all attendees. That's also a place where really pushing to get vaccinated can be helpful, because if you've been vaccinated, that might help replace the notion to be tested to attend those events. With the exceptions of graduations, which DBR, our Department of Business Regulation, is already working with entities on, plans are required in advance for all events with more than 500 people so that we can work with them and really make sure that the steps are in place to keep people safe. And any request for outdoor capacity above 500 people must be submitted in advance to DBR 30 days prior to. When it comes to catered events at which food will be served, we are making incremental changes related to capacity starting in May with that May 15th timeframe as well. More information will be posted on Reopening RI tomorrow, and if there are any questions on those changes, Secretary Pryor is here to provide detail. The last thing I want to add on all events, catered and not, is that the way for you to help all of these happen is by getting vaccinated when you are eligible. If we can do it even sooner, with more people getting vaccinated, that's great. If you want to help your child's graduation happen, get vaccinated. Encourage your friends and family members to do the same. If you want to go to that wedding that's on the calendar for this summer, get vaccinated and encourage all those who are attending the wedding to do the same. If you want to help us deliver on the governor's promise for fireworks on the 4th, get vaccinated. It's a way we can really enjoy and do it safely and know that everyone has the protection needed. Vaccines are safe, they're effective, and we're working with our federal partners to have more and more vaccine coming into Rhode Island each week so that you can take advantage of it. And we can all center around these dates and timeframes to continue to advance forward. With that, I'll pass things on to Tom McCarthy, who will go into more detail on our vaccination operations. Thank you.
Good afternoon, and thank you for those updates, Dr. Alexander Scott and Governor McKee. As the governor shared, we're continuing to make strides in terms of getting shots into the arms of Rhode Islanders. We had a great week last week with more than 85,000 doses administered, and also opening 3 additional vaccination sites in Westerly, Johnston, and East Providence. We've also gotten off to a strong start this week. We've already administered about 18,000 shots, and we're projecting to be able to administer a total of 86,500 doses before the end of the week. Another exciting development is that we've started to send out appointment notifications through our pre-registration system, as the governor had shared previously. As a reminder, our pre-registration system is a way for people to submit their information in advance and then get notified when an appointment is available for them. You can pre-register through the Vaccine Interest Notification List, which you can join through portal.ri.gov or by calling 844-930-1779. So we're able to send out about 8,074 appointment notifications yesterday to people who had pre-registered, and we'll continue to refine and expand upon that based on demand each week. A last note I want to relay on pre-registration is that people can make appointments, continue to make appointments through www.vaccinateri.org or other venues without pre-registering. It's not a requirement, but just another avenue to try and make the system that much more approachable and that much easier. When it comes to specific communities, we have a laser focus on the communities that have been hardest hit, as Dr. Alexander Scott had touched on when referencing our equity-focused vaccinating at the Dunk and at Woonsocket this weekend and next weekend. Yesterday, we identified an issue where cancellation emails were sent in error to roughly 1,400 people. These people's appointments were not actually canceled, but the email suggested that they were. We immediately contacted everyone. The systems issue has been resolved. The appointments are still valid, and we're working with our community partners to ensure that there is no confusion. I also want to thank our community partners for the strong partnership there to ensure we continue to get folks registered for these clinics. On top of this effort for this weekend and next weekend, we've also lowered the age eligibility to certain harder hit communities earlier. For example, at the end of March, the governor announced that we were expanding age eligibility to people 16 and older in our 8 hardest hit zip codes, which cover parts of Providence, Cranston, North Providence, Pawtucket, and Central Falls. As Governor McKee shared earlier, we are expanding that to Woonsocket on Friday, and on Monday we will expand eligibility to everyone 16 plus in additional zip codes in West Warwick, Providence, Cranston, North Providence, East Providence, and Johnston. These zip codes are 02893, 02906, 02910, 02920, 02911, 02914, and 02919. People in these zip codes will be eligible for vaccinations at state-run vaccination sites, local and regional sites, and at all participating pharmacies in Rhode Island. Before wrapping up, I want to echo the sentiments of the Governor and Dr. Alexander Scott and urge Rhode Islanders to do their part and continue to support one another. We're at a crucial moment right now. If we can hit those May 15th and June 5th marks that have been shared, I'm confident that we can transition out of the COVID response and into recovery. But to get there, we need to keep the demand high. To vaccinate 755,000 Rhode Islanders and hit that 70% of the state threshold before a vaccine is approved for those 15 and under, we need to get everyone vaccinated as soon as we can when they're eligible. On top of getting yourself vaccinated, help a family member, a neighbor, a friend. We all need to continue to do our part as we have throughout this pandemic, as we all have a role to play. With that, I'll pass it on to the Commissioner, Angélica Infante-Green, and then I'll be happy to take any questions.
Thank you, Tom. Good afternoon, and thank you, Governor McKee, for having me here today to share some exciting news on education. As you heard last week, we are following the CDC guidelines, and we've gone to 3 feet and 75% of the capacity on the bus transportation. That's going to go in full effect on March 26th. Most of our districts have already begun to put those in effect before the vacation. We know that in-person learning, I should have taken my mask off. I'm so used to it at this point. In-person learning is one of the most important things that we could do for our kids. Ya como ustedes saben, nosotros hemos movido con el CDC a 3 pies y a 70% de capacidad en los autobuses para llevar a los niños a las escuelas, porque es sumamente importante que nosotros le podamos ofrecer a nuestros niños instrucción en persona. So the guidance allows us to bring more kids in because we have a few schools that are still hybrid, and we want to have our students have the opportunity to come inside into our school buildings. This wouldn't have been possible without the leadership of the governor, the Department of Health, and our local leaders in providing vaccines to over 89% of Rhode Island educators. Thank you, thank you, thank you. Esto ha sido posible por el liderazgo del gobernador, del Departamento de Salud y todas las personas locales, los líderes locales, por darle la vacuna a los maestros. Tenemos ya 89% de los maestros que ya han recibido sus vacunas. So, we're excited. But we don't want anyone to relax the procedures. So we have to continue to wash our hands, continue to wear the face mask, as I was doing a few minutes ago, and maintain our distancing. It is important as we move forward. We don't want to lax in our regulations and our expectations in the classrooms. Aunque ya tenemos la vacuna para los maestros y los niños que ya van a tener 16 años para arriba, es importante que nosotros todavía mantengamos las mascarillas, y también que tengamos el espacio y nos lavemos las manos. Eso es muy importante para nosotros. The other part that's pretty exciting for us is that we're working closely with the Department of Health as they determine the guidelines for proms and graduation, because we know how important this is for all our kids, and we want to make sure that this is part of their experience in this coming year. Nosotros estamos muy agradecidos de trabajar con el Departamento de Salud en lo que ellos desarrollan las medidas que se van a llevar para poder tener los bailes que se dan al final del año y las graduaciones este año. Sabemos lo importante que es para nuestra comunidad. So, as we come back from April vacation, many of our parents are thinking about the same things that the governor talked about, summer. right? So as we get ready for the summer, I want to announce that RIDE has put out a bit of our RFP so that we can talk about what we're going to do in the summer. So last summer, we ran our first summer school statewide. We had 99% attendance, and the kids that attended increased 50 points on their SAT scores, and the kids that were further behind went up about 100 points. So we are offering this once again to all our populations throughout the state, and we're making sure that these opportunities are accessible. And in order to get to that place, we created a group of experts, which is the Learning Equity Acceleration Pathways, where we brought national leaders, local leaders, parents, CBOs, all to the table so that we could work together to make sure that our kids get the best education possible. Para nosotros tenemos ofertas, se lo digo a los padres, por favor, para los niños este verano, gratuitos, para que ustedes aprovechen esas oportunidades. El año pasado los niños vinieron, 99% de ellos vinieron y asistieron y vimos aumentos en las notas que ellos recibieron a través del examen que tienen que tomar para ir a la universidad, por favor. We're going to keep pushing hard as we have done. Educators have kept their foot on the pedal, and we're going to continue to do that for all our entire population. So all our proposals, we've received 136 proposals so far, and we're extending that for anyone else that wants to apply until April 14th. And on May 3rd, parents, you can go on to Enroll RI and see what is eligible for your students, for your children. Para todo el mundo que quiera aplicar, hemos recibido 136 propuestas y va a estar abierto hasta el 14 de abril. Pero para los padres, óiganme bien, el 3 de mayo pueden ir al enrollri.com para ver todo lo que le estamos ofreciendo para sus niños. Quería darle las gracias y estoy aquí para apoyarlos. And I'm here to make sure that we provide the best education possible in the state of Rhode Island. Thank you.
Of reaching the hard-hit communities of color was repeated multiple times. This error that Mr. McCarthy mentioned about the cancellation notices being sent in error, while it's being fixed and trying to be addressed, has the damage already been done, especially with people who you're trying to reach and who have not been vaccinated as high of a rate? And people may look at it as, why is this happening to us?
Yeah, so the damage is not, we've already corrected that, and that's the reason that we addressed it here in our comments today. We're going to continue to try to close the gap. I've been on, I think this is the third week in a row that I've mentioned about the difference between the vaccination rates in the black community, the Hispanic community in particular. That's going to be very measurable. So we're going to find out whether we're actually closing the gap on both of those with the work we're doing, and we expect that that's going to happen. The news that we want people to know right now is that there is still appointments available for that community, and then the Equity Council and many people in the ministry, along with Jim Vincent, NAACP, and the Hispanic leaders in the state, are trying to organize that. And I think that's really good news, that the fact that we have community leaders that are really helping us close that gap.
So what happened with that? Why was there a mistake?
I'd have to ask Tom on that one. He would know that.
Yeah, as we've continued to add functionality, one of the things that was added was the ability to cancel entire appointments tied to pre-registration and a few other things. So we identified the issue through internal quality control checks yesterday, and quickly were able to contact everyone and fix some of the functionality and systems issues. To your point, though, where we're going to be successful is in building and sustaining the trust with our community partners, as the governor has shared multiple times. So we're continuing to work closely with them, ensure that everyone that had an appointment knows that they're good to go for this weekend, and continue to add folks to these clinics this weekend.
Does that dent the trust, an issue like this?
I'm here to earn trust every single day, everything that my team does, so I don't think it will. And we'll continue to ensure that we have those good relationships with the community leaders that are going to help make us all successful here.
We're building trust, by the way, on that by just doing the activity as quickly as we are and recognizing that there is a gap, and we're going to close that gap. That's what's going to, when we close that gap, that's what's going to create the trust that we all need in the state. Everybody get vaccinated. Yes?
A lot of businesses are complaining that workers won't come back to work. They want to stay on unemployment. It's widespread. We're about to enter into summer tourism season. I understand there's a bill pending at the State House or being talked about. There'd be some kind of incentive to get workers, because otherwise, between the Biden money and locally, they would actually make more money by staying home. Do you want to address the local
quickly, and I'll push it to Stefan, who's prepared to kind of talk specifically about it. I've been on the record for some time stating that there should be some level of procedure to allow the benefit, the additional benefit on employment, to travel with the individual back to work. So I'm open to that discussion. I don't know whether we need federal buy-in or not, but I've been open to that. So we'll see the particulars. I'll let Stefan maybe talk. I know that Matt Weldon asked us to make a few comments on that if the question was asked. The other point that I would make right now, though, is that most of the people who are looking for workers are the minimum wage workers. So it really does show how important, not only that our small businesses are in the state, but how important our minimum wage earners are. And so it certainly supports the idea of moving towards that $15 an hour. I'll let Stefan weigh in on what Matt wanted to mention.
Appreciate it, Governor. Very much along the lines that you've already expressed, Governor. Director Matt Weldon at the Department of Labor and Training is exploring a number of options. He's looking at the federal rules as they exist and seeking greater clarification about the $300 additional incremental payment and whether it can follow someone if they are working part-time, that is to say, if they are unemployed part-time. So we're exploring whether with entry into the UI system and simultaneous reentry into the workforce, some of that additional benefit can follow. So that would provide an incentive for people to go back to work. We are conscious that there are also bills that are being introduced along these same lines, and we, Matt Weldon and I, are in dialogue with some of the local business people who, bless them, have put the work in and are trying to figure out some solutions. And we also likely will be reaching out to Washington. Yesterday, I had a call with fellow commerce officials across the country, state-level commerce officials, and this is an issue that is beyond Rhode Island, of course. It's an issue that other states are considering, so we may seek further federal clarification or even legislation in consultation with our congressional delegations. What that all comes down to is Director Weldon's trying to see whether within the rules and even without legislative change on the state level, we can do something significant.
Is that why Rhode Island?
That issue, though, with respect, a private business owner, Dave LeVay of Bird Awakenings, with the support of dozens of private businesses in the hospitality space, has actually authored innovative legislation that would specifically address that imbalance and also seek to use part of the stimulus funds to bridge that gap with, I think, a pretty innovative 13-week basis, 2 to 3-fold, which would provide bonuses for concurrent input. That bill is being sponsored in the Senate. What is the status of that specific legislation? When do you expect passage? And most importantly, under the McKee administration, are we going to see sort of a new era where you've got stakeholders like Mr. LeVay and other members of the hospitality or other industries actively engaged in the generation of legislation as opposed to the top-down method, which has for so many years been such a failure?
So yes, I've been in contact with David, and I've been on the record for months saying that the benefit, the additional benefit, should some way follow the employee into the the workplace. So I think you just heard an overview. We're certainly open to that. We got to make sure it's legal. We don't want to give any money back to the federal government. We got to make sure we do it properly. So to answer your question, yes, I do believe that there should be a strategy where the benefit follows the the person who's on unemployment into the workplace.
Dr. Alexander Scott, good afternoon. I wanted to drill down a little bit on graduation, because what sounds good in theory may not meet the reality of venues that schools have, capacity. And while it sounds nice, the numbers, there are a lot of places that would not be able to accommodate that many people inside and continue to social distance. So first, is the social distancing 3 feet? What is the social distancing? If you have to hold graduation in a gym, how does that look to you?
We are still requiring the 6 feet social distancing space, but the involvement, as I mentioned, with our state team with DBR, supported by Department of Education and supported by Department of Health, we would work with an academic institution to make sure that they have what's needed to accomplish. There are creative ways to make it happen, and it's good that we can do it in person this year.
The CDC is saying 3 feet in schools. Why aren't you loosening up on that?
The 3 feet component is specific to the structured environment within a classroom. And from CDC's standpoint, it was specifically for the younger school ages. We are applying that a little bit more broadly in Rhode Island because of the strong partnership and our ability to help ensure that it's done effectively. But in other settings, in public venues, in other areas, the 6 feet is important to continue. And what we want with these events is for everyone to follow the venue of assembly approach, particularly in areas where there is no food that's there, and allow for the mask wearing, the distancing, and strongly recommend the testing or being vaccinated where it's supported.
So it goes back to, you want to give people a light at the end of the tunnel. We hear every week, vaccine, vaccine, vaccine. If I'm a parent, I'm thinking, what difference does it make? Because they're going to have me 6 feet apart, and I might not be able to make it into my kid's gym. Do you anticipate? Now, last year we talked about kids walking across the stage with masks, and that things may get better as the course of time goes on. Would you recommend for some high schools, maybe you want to delay your graduation a couple of weeks into June so the numbers might get better and we may have a different look than what you're talking about now the first week of April?
Those types of conversations have occurred with academic institutions so that there is that option in place. And it's why we really want people to understand these markers that we have set. The May 15th timeframe will mean 2 weeks after 70% of all those eligible to be vaccinated have had at least one dose. That's a milestone. That's really encouraging in terms of saying the amount of the population that is protected and for allowing for more of the flexibility. And we can be back with the governor next week to share some more detail on how we're doing that going forward. And the same for the June 5th marker. So knowing that institutions will have these options, they'll know the determining factor between the May 15th date and then the June 5th date, getting as many people vaccinated as possible, and continuing to support the incremental reopening that we have taken the approach of doing.
For Governor McKee. Governor, you've created vaccine groups, hard-hit communities. Tom went through the whole zip code situation. What about high school and college seniors? I know that the institutions of higher learning have reached out to you. This is once in a lifetime. There are people who've never had their kids graduate, and now they're faced with the reality of kids graduating but parents not able to go. And then you look to the fall coming back. Isn't that a group that you would like to target and get them vaccinated sooner than maybe some others?
Yeah, and I do, and there are other people who are asking for the same, courtesy, and I think that it's important that we do that. So as we get those benchmarks that the doctor was talking about, we're planning in advance that the supply is going to increase and is going to allow us to do into those areas. We were on Newport this week, Sabina and I were on in Newport talking about the Newport's need to be vaccinating restaurant workers. So we're trying to get those numbers together in the state, specifically in terms of the high school students who are in that 16 and older age group. Well, I think we're going to be in a position, especially as you're suggesting that the graduation could get delayed to the second week of June or third week of June, right? We're going to be in a position to kind of hit those target areas. And we're starting to do that work right now. We're identifying office buildings right now. I was talking to a couple different businesses down in Quonset that are in the military area with electric boat they're asking for the same type of courtesy, so as well as Amgen is. So we have these pockets of people that we think are going to be important to vaccinate, and so we're starting to do that planning. But right now, we have a plan. Right now, as Tom said, 86,000 or so doses last week. We still have more of a demand than the supply, so we're just going to stay on the course we're on because that's getting us there. But then being flexible, as you're suggesting, I think we're already doing it, but it is a good supportive comment.
Alexa, Anita?
Yep. Are we still on track to make sure that people over 40 are going to be eligible on Monday?
Yes, we are.
Okay. And then some volunteers with the City of Providence went door to door in the zip code 02907 this past week, talking to people, canvassing to make sure that they get signed up for the vaccine. I did see some hesitancy, but the biggest issue was that they just don't have access, they don't have information that they need, and the system isn't really working for them when they don't have the luxury to work from home. They can't play with glitchy websites. So how are we making sure that we're not leaving those people behind, and is the state going to give the city any more resources for this type of canvassing?
Well, I can start and then Tom can add to that. It's exactly why we have the pre-registration approach so that we can really reach the individuals who may be challenged with, having the time to go in and register. And we know how important the access component is. So we've actually calculated the number of clinics that exist within those zip codes that are hardest hit. And as the governor shared earlier, the majority of individuals do not have to travel beyond 15 minutes to get vaccinated. So our focus, both with this weekend on our equity-focused clinics and for the weeks and months beyond, is to continue to meet people where they are and help ensure that whatever barriers to getting vaccinated, we can overcome together and really reach those targets for the May 15th, June 5th, and beyond.
Governor McKee, the right to control an individual's body has rightfully been the subject of aggressive legislation these past few years. Why then isn't the state of Rhode Island displaying an equal passion in defending the rights of students in the face of mandatory vaccinations by colleges and universities, particularly given the fact that these vaccines have yet to receive full FDA approval and an incredibly low incidence, apparently, of hospitalization or serious cases of COVID amongst this population?
Well, I don't get the connection, but I'll address the issue in terms of the universities. They have already in place vaccination strategies and policies that chickenpox, you got to have vaccination. We support it for the very reason that we can get more people vaccinated. 62,000 students in the state of Rhode Island live in the state of Rhode Island, attend our college universities. That's going to be a big shot in the arm over the summer if we don't get it to us sooner. And then to the earlier point, high school students, we're not making that mandatory, but we're strongly recommending that all the high school students 16 and older get vaccinated for the very reasons that the reporter just talked about, to get people to be able to go to graduations, to be able to go to their proms and that type of thing. So the colleges, we're very supportive of their policy that I have talked to every college president, and they actually asked us and asked me to get the health department in with them. It's an important point. 62,000 residents of the state of Rhode Island attend college, and they're in an age group that we're very concerned about getting vaccinated. So we applaud the college universities for doing that.
I'm sorry, I want to go back to my question.
Alexa, how to follow up, then we'll go to Anita.
Yep, thank you. Sorry, Tom, I wanted to hear what you had to say about hard-hit communities. I think that it's really important for people to hear this.
Yeah, absolutely. So, it's not just about getting shots in the arms as quickly as we can. It's getting shots into the right arms, recognizing the communities that have been hardest hit and historically underserved. So a big part of everything that we're doing, concurrent with these large mass vaccination sites is partnering with our local and community partners around how can we increase access, create additional opportunities. So a big part of that is being out in the communities and doing the canvassing, but continuing to learn from folks that are closest to the community and understand what's going to work best for them. So we're going to continue to build and expand on that. I think we're reaching a critical juncture here over the next few weeks where we are going to have more supply than demand if we're not deliberate and intentional in meeting Rhode Islanders where they are. So something we're building on every week.
Just a follow-up to that as well. Some of the people that I spoke with and that I observed while they were signing up, one of the biggest issues was that they didn't want to fill out all the very personal information when signing up. One of the reasons is they're undocumented and they're fearful of where this information is going. Is there any, future mobile clinic where we can bring shots right to people and we don't have to ask for all of their information, possibly just their name, date of birth, and then end it there?
I think there is. And what's important too is when people show up to the registration sites, we're not asking for your identification at the state-run mass vaccination sites. We're not asking for your insurance card, right? So they shouldn't be concerned in that regard. But I recognize that's a real, fear for many Rhode Islanders here. So we are already piloting some mobile clinics. We're not quite yet at the point now where we have enough supply where we don't require people to pre-register or register ahead of time. But those are things that we're going to test and we're going to see what works here in the near future.
When could that be rolled out?
We're actively working on those each week. There are already some mobile clinics in Providence. We're continuing to expand that capability. The good news is, we have a lot of federal resources specifically focused on building confidence for vaccines. So I think there's a great opportunity to continue to build upon these partnerships. But these are days and weeks out. This isn't long-term work. So we're going to get done now.
Dr. Nicole Alexander-Scott, Providence announced 3 clinics for the weekend for their hard-hit zip codes. There are still hundreds of unscheduled appointments. Why aren't they being booked faster?
It's all part of what we've just been discussing now. It's the ability to meet people where they are, continue to make the points of access as available as possible, and help understand what barriers are in place to be able to overcome them and ensure that every individual from every zip code is able to get vaccinated. Just continuing to get out into the community. We really applaud and celebrate what Central Falls is doing and what was just mentioned about a zip code in Providence, going door to door, engaging with places of worship, engaging at employer sites, going to either a mobile clinic or places where people shop to meet them where they are and help make it as accessible as possible.
Are you worried that those false cancellations are going to deter more people from actually signing up for an appointment?
No, we're not. We've addressed it. We've called the individuals or are reaching out to them to help ensure that they know. Those type of elements everyone understands is a part of, what happens with technology, and it's really just the key of overcoming it, correcting it, and continuing our engagement with community leaders to strengthen the word about how important this is. So helping everyone really talk about, let's get as many people vaccinated as we can by our May 15th date, and then our June 5th date is a way for us to rally around this together.
I have one more clarification in regards to the next tier of people that can sign up. Will they have access to mass vaccination sites or just community clinics, or both?
Both, definitely both.
On March 4th, can there be dancing at proms?
Yeah, we are supporting proms to follow our current catered events requirements, which allows for specific pod dancing components that I'm sure Secretary Pryor can go into more detail on, if he'd like.
Sorry, what does that mean for the high school students who are like, what can I do at my prom? When you have to tell them what is pod dancing.
The basic idea is that pardon.
Demonstrate.
Yeah, that's a very good idea. I think if we orchestrate ourselves up here together, it's basically that you can dance with your table. So if you're orchestrated at a table, you can do that. It's with the people that you are that you came to the dance with, and people sitting at your table with you, and there'll be more guidance online. I will note, while we're talking about catered events, Dr. Alexander-Scott referenced that there's some more flexibility that's been granted to them, and since we're discussing the issue, I just want to mention very briefly for those catered event professionals who've been asking. Currently, we have I'm going to make a couple points here. First of all, we currently have a requirement that at events with professional caterers, Above 15 attendees, testing is required. We are making the following change given the progress with vaccinations and our stability in our public health conditions. Above 50 outdoors. So if you have more than 50 attendees outdoors, testing will be required, not below. And just another quick notation for catered events. Dr. Alexander Scott has defined the important demarcation points of May 15th and June 5th. So there'll be more flexibility for catered events in accordance with those two dates. First of all, the current guidance is 100 permitted indoors and 200 outdoors. Those are both the maximums. By May 15th, that will go to 150 indoors, up from 100, 250 outdoors, up from 200, and that's May 15th. On June 5th, up to 200 indoors and 300 outdoors. And outdoors, speaking of dancing, there'll be more flexibility provided. It will not be required that pod dancing occur starting in June, given the hope and the expectation of better public health conditions.
Wear a mask too. Would the students have to wear a mask?
We will, yes.
Hand holding allowed at the prom? Fourth, you were with us, and I asked you about the Providence schools, and you said you were in the 9th inning of the game. We've since learned from the Boston Globe you're actually now apparently in separate rooms during negotiations. How did that start? And do you want to go back and revise, since today's the beginning of the Masters? I'll give you a mulligan. Where would we now be in the course of a game?
So we are in separate rooms because we are in mediation, right? And that's how mediation works. It's not that we chose to be in separate rooms, but the mediator goes back and forth, and we try to agree upon different things that we each want. So that's where we are. We've taken a few steps back. I think we're having different types of discussions. I think that there are things that we all feel we need to move forward. And some of the things that we have been discussing, almost every single superintendent that has been in the district has been asking for.
John, last question.
Yeah, a question for the doctor. Should people who have been partially vaccinated or fully vaccinated still get tested?
Yeah, it's a great question. Because we are aiming for those goals that we've shared of May 15th and June 5th, where we have more than 70% of the population, either those eligible or all of Rhode Islanders, at least partially vaccinated, we are really continuing to promote the value of getting tested during this time frame until we can reach some of those milestones. Particularly with the variant present, testing is valuable for helping to identify whether or not someone has been exposed to a more contagious variant, even if they themselves are partially vaccinated, because we still have not reached the full herd immunity where the majority of our population is vaccinated. They may expose the virus to someone else who is not vaccinated. So there is value in getting tested. We continue to lead the nation. It's a resource that we want everyone to continue to take advantage of every week during this time frame. As we reach those milestones, May 15th, June 5th, and beyond, we'll be able to provide some updates then about being able to pull back. But for now, we want everyone full steam ahead with testing, treatment, and vaccinations.
Apply to people that have had COVID?
Yes.
How soon after they've had COVID should they get a test?
We use, for regular surveillance testing, the regular testing, we are saying a 90-day period is acceptable for that. But if someone develops symptoms that are consistent with COVID and has been exposed, or even if they haven't, we would recommend testing to evaluate those symptoms.
For some catered events, they require, aside from school events, they're requiring a negative test even if you're fully vaccinated. Can you explain the explanation there? Like why?
We are actually working to develop the opportunity, really encouraging people to get vaccinated, that if you are fully vaccinated, you may not need to fulfill the testing requirement in some of those events. So it's why I went through, if you are attending a wedding that's coming up during those time frames, encourage everyone to get vaccinated in advance. That will be a helpful alternative to the testing requirement that's in place. And we'll be providing some of those details as Secretary Pryor shared.
Governor McKee, for the record, are you
They will
supporting
change.
mandatory vaccination for non-FDA approved drugs?